Kindly confirm the audio and the video, and any doubts and any questions. Quickly, any doubts and questions about disaster management? We had a special class on that also today. If there are any questions on that, please, you can ask now. Whatever questions you have, you can ask me quickly. No questions? Are you talking about disaster management? Okay, so if you don't have any question, then let us write a question. एक आंसर लिखेंगे everyone? Can we try writing an answer? Yes, let us see if we can write an answer quickly. So we were talking about cyclone. Yes, last was cyclone hazard, no? So let us write on this. In coasts present, Indian coasts present hazards of or hazards and opportunities to coastal people. Elaborate. Easy question. By that time, people will join also. Let us see quickly. Coastal. That you have really done well. Conclude it and see what you've done. So I hope everyone is done with this. No submissions. Everybody wants to submit me answer. Otherwise, the main invite करता हूँ तब कुछ नहीं. Yes, sir. मैं अपने answers खुद लिखूंगा. Will you check every day? Nobody is interested in that. So I hope even the people who are doing the recorded classes, they are also doing this. Yes. Are you still with me, everyone? So when we are talking about Indian coast, present hazards and opportunities, so I'm very sure there are 3 pages. This should have gone in hazards with a map, with the case study. Maybe hazards can continue. Here opportunities can come. and here way ahead can come. First of all, the answer should have been somewhere when we are talking about answer is structuring में, we should have paid interest in that. Is everyone with me on this? So we should have given it a thought, and if we have given it a thought, the answer should look somewhere in this category. Is everyone with me on this? Now, if you look at your answer, have you been able to do something like this? So पहला तो है in the arrangement of ideas, in the thought of ideas, you were able to do this. This is a good thing. If you were not even able to do this, then it's a problem. Okay. So can I say Indian coasts or coastlines, Indian coastlines are a unique physiographic division. Yes, unique physiographic division. So I've used my word, offering its own sets of hazards and opportunities as elaborated below. So since we are into elaboration, we can very well elaborate. Is everyone with me on this? Can we elaborate or not? I think we should be elaborating on that. Are we clear? Next, what are we looking at? What are the hazards? So a hazard map should come. So quickly, everyone make 2 maps. And if you have already made in your answer, then you can just have a look at that and tally with my map, which I want to bring. Yes. So let us look at that. What are we having in this whole scenario? So in this scenario, I am going to look at, first of all, can I say cyclone and sea level rise? Mean sea level rise. These 2 are big ones. Can I add to it tsunami? East coast. True. So first is I would be making the cyclone tracks we had already talked about yesterday. So I need not add and elaborate on that. Only thing is that west coast cyclones, they will be recurring. Is everyone okay? That's one thing. Mean sea level is rising, so I will say MSL rise. MSL rise will have a primary hazard, and this will also give rise to secondary hazards. What are secondary hazards? Can anyone tell me? Associated with this, secondary hazards associated with sea level rise. Secondary hazards associated with sea level rise. Quickly. कल बताया था salt water intrusions, absolutely okay. So can I say one is to MSL, to submergence is there. Submergence is the primary one, but submergence can lead to aquifer salinization. Submergence is there, that is there. Salinization के अलावा storm surge, therefore high coastal erosion, coastal ecosystem damages. Yes or no? Storm surge, this thing, and a lot of floods on account of that. Storm surge से coastal erosion भी होगा and floods will also be on account of that. Is everyone with me on this? Do we get that? With me on this? So ये हमारे कुछ हो गए. Can I also say here urban hazards? Urban hazards, can I say coastal cities? Coastal cities have greater vulnerability. Yes or no? Greater vulnerability. So can I say Mumbai, Mangalore, Cochin, and Chennai, Paradip, Vizag, whatever we are looking at. Can I say coastal cities and ports? They have greater vulnerability. Should that be marked? So would I be putting Bombay here, Mangalore somewhere here, Cochin, Tiruvananthapuram, Chennai? That should be marked, okay? Paradip, Visakhapatnam, and this whole area, the Kolkata wetland regions. Everyone with me on this? Any question on this? So I would want to specially acknowledge this. True. What kind of hazards are these? Natural or man-made? Can I call them natural? What are the man-made hazards which we have on the coastal areas? Man-made hazards. Quickly, man-made hazards. Can I say CRZ regulation violations, non-compliance? Can I say wetland? Mubasir, can I say intertidal vegetation, even mangrove disturbance? So when we play with that vegetation, our proneness, does it increase or not? Yes or no? Slope modification, and sand mining. The question is going because of that also. Is everyone okay? True. Can I also say garbage disposal, especially plastic waste? Remember, these are hazards. Whether they will turn into disaster will depend on many things. I've already told you the vulnerability and other things, all other factors will matter. Is everyone with me on this or not? Everyone clear? So पहला तो hazard होना चाहिए. Can we explain this? Can we elaborate this, everyone? Can we elaborate this? एक बड़ा hazard मुझे यहाँ पर लगता है everyone coastal area में. So can we add cross border terrorism, Mumbai attack? मतलब वो hazard उस तरह का नहीं है कि like man made hazard or something. This is not about coastal problems. So I'm not looking at that. फिर तो geopolitical tensions भी हो सकता है and all those things. Let's be into something which is more pertinent to this. मुझे लगता है यहाँ पे जो port activities है ना, Gulf of Kutch and this thing, port activities. Especially if you remember Alang port. So Maheshwari is saying coral bleaching. So did I say coral bleaching? What are the problems of the coast? No, I'm saying I'm looking at the hazards of Indian coast. Natural hazards. So we are looking at flood, storm surge. This is already happening. If you want, you can put it in climate change, global warming. उस वजह से क्या हो रहा है वो फिर वही mean sea level and all those things. Flood, storm surge, temperature is increasing and all those things. So those are things which we are looking at, but we are looking at something direct which is happening in these areas. Is everyone with me on this? Any questions? So we had to elaborate on these. Here you can take a case study of Alang ship breaking yard. Yes, as somebody rightly said, oil spills. Coastal zones. Everyone now look at this. How many of you feel that you were comprehensive? So earthquake in Bhuj. Beta वो coastal नहीं है ना, earthquake in Bhuj. ये थोड़ी कि जहाँ पर भी होगा, कुछ भी होगा, Bangalore में flood. Question की specificity तो समझो. At least be specific to the question that is asked. Quickly, how many of you feel that I had all these dimensions in my answer? Quickly select a poll. Yes, I was this comprehensive. When we are talking about comprehensive answers, can you select yes, I was this comprehensive in my answer? Okay. So I see around one-third people were like this. So first of all, can I say brainstorming has to be exhaustive? Brainstorming has to be exhaustive. If you are just doing an elaborate question, even there, the brainstorming has to be exhaustive. Second one. So let us forget this. I'm sharing this, but so some people said that, okay, how did you put this content? That will also be a question, that how will you put it? So first is content should be there, and then context comes, how would you put it? So that is answer writing. Second is, what are the opportunities? So what opportunities did you see in the coastal areas? What opportunities did you see in the coastal areas? Hotel, coastal plain, aquaculture, tourism. So अगर मैं opportunities देखूंगा तो I will say ecological, economic, socio-cultural, and even geopolitical. Why would I do the same thing which I was doing in the previous format? Will I change my format or not, everyone? Think about it. Will I change my format or not? So I should be changing my format. So ecological opportunities, can I have ecological opportunities? Can I say that I can go for mangroves? I can go for coral reefs. These are very important ecosystems, their conservation and restoration. Yes or no, everyone? I also want to tell you that this will lead to what? Carbon sequestration. True? Would we want to do that or not? So ecological importance is carbon sequestration, very important. And if you remember, we have blue carbon and all those things. So these are more important in terms of that. So biodiversity conservation is going to happen, as well as this thing is also ecosystem restoration. And are we in a decade of ecosystem restoration? Important or not? We are looking at important. This also leads to another one, is the coastline stabilization. Coastline stabilization. That's again ecological one. Otherwise, the coastline can be receding. Do we get that, everyone? Now, you will find that when I'm talking about this, I'm talking very specific things on that. Ecological. SDG 14, why not? We can very well talk about this. SDG 14 is about that. So the targets and the sub-targets can be achieved from that. Makes sense? Economic में, I would want to go for primary activities. Primary activities, I think mining is possible. Many resources are available. Mining is possible. Many resources are available. Say, for example, Kerala coast, Malabar coast, popular for what? Monazite sands, yes or no? Do we have offshore oil also? So we have. Those are opportunities. Mining is there. Can I say agriculture? Lot of the deltaic soil, possible. Can I say in secondary, we have the port-led development model, where Make in India, the idea of SEZ, NEMZs, NIMZs, possible. वो हो गया, shale oil, everything goes in mining. What are the tertiary services that are there? Can I say tourism? Can I say tourism? That is there. Socio-cultural. Imagine our coastal areas. Coastal areas have many places of reverence to people. Yes. Dwarka, Rameswaram, West Coast, East Coast, Sagar Island. Yes or no? Example दे सकते हैं. Dwarka, Sagar Island, East Coast. Even cultural. If you remember that, what is this cultural in the Kayals? Lagoons. Lagoons में नेहरू का race होती है ना LFP में. The boat race. नेहरू का race. Opportunities. We can make it a global site. True or not? We can very well do that. Kayals or lagoons, the same thing. Geopolitical and strategic. Everyone, can I say strategic? We have many missile testing range, satellite launch centers, coastline, no? True. Can I say satellite? Maybe we can have port, naval ports, and shipyards. अभी क्या निकला है कल? I think announce हुआ ना? क्या है? क्या नाम है इसका? तारागिरी, the stealth frigate. किसने बनाया इसे? करंट अफेयर्स मजगांव डॉक से आया. मजगांव डॉक्स ने स्टेल्थ फ्रिगेट बनाया. इसमें इस सीरीज में दिस इज द प्रोजेक्ट 17. आई थिंक सबसे पहला आया था नीलगिरी. यस, INS इंडियन नेवल शिप नीलगिरी. उसके बाद उदयगिरी, नाउ तारागिरी. ट्रू और नॉट? थर्ड हमने भी निकाला. सो इंपॉर्टेंट पोर्ट्स. फिर अभी हमने अपना इंडिजिनस एयरक्राफ्ट कैरियर. यस, एयरक्राफ्ट कैरियर भी हमने किया. सब कुछ है. जॉइंट नेवल कमांड्स जैसे हमने बनाई है. सो नेवल कमांड ब्लू नेवी. यस, जियो पॉलिटिक्स ऑफ IOR, joint naval exercises. Now tell me, this second part becomes important now. Did we have sufficient to write on this? Map se bhi banega, ye bhi banega. Two parts of it. Are we that comprehensive? Today, two things which I wanted. This was part 1 of this question. This was part 2 of this question. Did you see? In one case, I gave you a sample of image-based answering, and in the second case, I gave you heading-based answering. Bring diversity in your answer. Bring diversity in your answer. And again, saying I'm talking to a class which is almost completing its course. Most of you who were from paper 1. People who joined me in paper 2, I am very sure that even paper 2 you are completing paper 2. इतना तो thinking linking आ गया होगा. True or not? So I'm looking at this. If this is happening, then we are on to that. I would want today you look at your answer. I have given you some answer. Every day I want the bar of the students, whether live class or recorded class, bar of the students to increase. If you are not into thinking like this is the last topic which we have kept. इसीलिए रखा है कि आपके पास DS के inputs भी हैं. Today also, very clearly we talked about these are the vulnerabilities. We said hazards, vulnerabilities, risks, they will end up in disaster. And then the question of disaster management will come. True or not? So these are the hazards which we have to identify. We have to identify the hazards. And can I say the vulnerability is also very different? West Coast, Gujarat, Maharashtra. I'm saying states which are richer states, better transport communication development is there. Yes or no? Compared it with Odisha, things will change. The vulnerability will change. Compare the cyclone disaster, its frequency is higher in Bay of Bengal than Arabian Sea. That's also there. So can I make a mention of it that these hazards which I'm talking about, these hazards have spatio-temporal variations also. Where would this line go, everyone? These hazards and opportunities have what? Therefore, planning must be done accordingly. True. Towards conclusion, can I say this? Way ahead. So West Coast में क्या करना होगा? Can we suggest something for the West Coast? Yes. Something for the East Coast. For the East Coast, can I write, more vulnerable for ecological damage? Yes. Population living over there. Higher size of population. Wider coastal plain. Remember, East Coast is wider coastal plain. So more population pressure over there. So in the end, can I say two different models will be there? West Coast, we have very narrow western coastal plain, and your Western Ghat is this thing. So we are talking about, we will have to, when we are talking about way ahead or conclusion, this is where we will talk about a new idea, and this is where we can, as morning we were talking about, the Sendai framework should be applied, SDGs in that light can also be looked at. True. Is everyone okay? Do you understand? Answer and where to take the answer will make a huge difference. So everyone, I want to quickly give marks to your answer. The answer which you have written, give marks to that quickly. Okay, 5 or 6. I'm looking at 5 and 6 wala kaam hona chahiye. Everyone, I hope you take a leap out of this. You can look at other scores, so that is why I did not want to intervene in this. We are looking at you being able to write answers. You can see answer writing is not just about books and classes. Yeah. So people have submitted yesterday's homework. Many of you submitted. I would say good work. People who have submitted, बहुत से लोगों का मैं देख पाया, बहुत से लोगों का नहीं देख पाया, but good work. So keep it up. Let us go to today's class. What is it? Epidemics पे चले अब. So what are epidemics? Quickly, what is an epidemic and what is an endemic? What is an epidemic and what is an endemic? जल्दी से बताइए. Is there any difference between them? What is a pandemic? Endemic is a particular place. Something which is restricted to a particular geographical boundary is called endemic. Yes, you're absolutely correct. So we are on session number 4. I got this map from Intech Open. So I wanted to show this for people for paper 1. Paper 1 also, if you're talking about disasters, you can talk about this also. So here कुछ examples हैं. Floods in UK, floods in Bosnia, typhoon. So I thought, just to tell you, since we were talking about disaster, cyclone Hudhud, earthquake in China, floods in India, Pakistan, droughts. So this is everyone for climate change paper 1. Climate change paper 1, this is a good map for you. So I thought of sharing with you. I've given the credit source also. You can find it from the internet also. Is everyone okay? So this is an input which I thought of sharing with you, because this question about climate change can come. Many times people don't have a single place to look at. So many things can be had from this. Endemic is something native, okay? Epidemic is restricted to geographical place. Pandemic is spread beyond particular geographical place. Perfect. So everyone, do we see the need of some definitions? Try correct? Can we try some definitions? This is generally, even the medical experts don't agree on this, so I thought of starting with this. An epidemic is a disease. An epidemic is a disease which affects large number of people, but within a community, population, or region. Everyone, please get that within. And you are just looking at, Aman, you're looking at local, regional. I'm saying within a community. Epidemic can also be within a community. Do we get that? Within a community of people, population, or region. Do we get that? Pandemic is something that spreads over multiple countries and continents, and we know novel coronavirus. Global threat type. Any other recently which has been aroused as a global health threat in the world? Anything else that you know of? Monkeypox. Okay, after coronavirus, monkeypox has been announced by WHO as a global health threat. So we must be, I'm bringing current affairs to that. I found this interesting sentence. Pandemic means a pandemic has a passport. Get that? So what is endemic? Something that belongs to particular people or country. That is endemic. So we have heard of endemic where can you tell me endemic in biodiversity hotspots? Have you heard something called as biodiversity hotspot? There the idea of endemism comes. What is that? A revision for all of you. Biodiversity hotspot is a place which has around 1500 more than 1500 vascular plant species. Must be endemic. ऐसे कुछ है? Am I correct with that? One of the criteria is. 2 criteria for declaring something as a biodiversity hotspot. One is that the plant should be endemic. Endemic means they are found only there. And second is habitat loss. I think 70% habitat destruction has already happened. यही 2 conditions होती हैं. Yes. 70% habitat destruction. Yes, Ambul, you're correct. Okay. So endemism is something which is found at a place only. So epidemic and endemic. Please understand, epidemic is a disease. Endemic is a general term. Endemic is a general term. What is an outbreak? When we hear in terms of epidemics, what is an outbreak? A greater than anticipated increase in the number is called an outbreak. Do we get that? Now I want to tell you, even a single monkeypox will be considered as an outbreak in India if it is coming to a new area. Do you get that? So India is not having a monkeypox. It is not the traditional area of monkeypox in India. But when it comes for the first time, what will it become? It will be the outbreak also. So even the first case is an outbreak. That is one thing. Second case is, in the second one, you can see that it is not the first case. It can also be, normally that this many people contract dengue or malaria, but suddenly we feel that so many cases are coming in. Similarly for bird flu. Yes or no? So such things keep on coming and we keep on getting those ideas. Is everyone with me on this? Are we clear, everyone? If any questions, please ask. यहाँ तक clear? ये तीनों definitions clear? Then I will talk further. I will take the matters further. Okay. So let us come back. Is lumpy skin disease epidemic? Lumpy skin disease ढूंढ लो यार. Lumpy skin disease कहाँ पर होगा? Epidemic will be, as I said, it is within a community, within a population, within a region. ठीक है सर्वेश्वर, किसी को एपिडेमिक डिजीज को करना होगा, सो विच रीजन इज इट, विच पॉपुलेशन आर वी टॉकिंग अबाउट, ये सब इज एवरीवन ओके? तो सर्वेश्वर ढूंढना होगा आज, ये नहीं कि सारे डिजीज पूछवाए सर क्या कैंसर एपिडेमिक है, यस सर ब्लू नाइल वायरस एपिडेमिक है, कुछ जगह पर होगा ना, देयर विल बी सम प्लेस वेयर इट विल बी कम्युनिटी पॉपुलेशन एंड रीजन, दैट इज व्हाट एपिडेमिक इज. What am I saying is that they can have the potential, so there would be an outbreak. Outbreak क्या होगा, greater than anticipated increase or a new area, a new area. If it is not quickly controlled, outbreak can become into epidemic. Do you understand सर्वेश्वर? तो कोई भी डिजीज का नाम लेकर उसको एपिडेमिक लगा देना, only when a disease goes into an outbreak. ठीक है, एपिडेमिक और एंडेमिक एंड एपिडेमिक का डिफरेंस बताता हूँ. Epidemic is something which will spread actively. So lumpy skin disease, if it is spreading actively some place, some region, then it will be given the status of epidemic. New cases of the disease is substantially exceeded what is expected, or probably it is coming to a new area. Is everyone okay? So we've already understood what is an epidemic. So as long as COVID-19 was in Wuhan, as long as it was in Wuhan, what was it? It was an epidemic over there. Get that? But it came out of the world, then it became a pandemic. Endemic on the other hand is a constant presence in a specific location. Say for example, malaria is endemic to Africa. Ice is endemic to Antarctica. I said endemic doesn't have to be disease. Endemic doesn't have to be disease. Can you tell me Tarai belt में कोई endemic disease of Tarai belt of India? Tarai belt में endemic क्या है? Malaria and Japanese encephalitis. Heard of that? जिसको ब्रेन फीवर बोलते हैं. सोनल वेक्टर बॉर्न डिजीज. सोनल स्पेसिफिक होना पड़ेगा ना, इधर मलेरिया लिखा था ना, which disease is endemic to Tarai in India? Do we get that? So Japanese encephalitis and malaria, they are endemic. Will they become epidemic? As somebody said, sir, is malaria epidemic? Is malaria epidemic? No, malaria is endemic to the Tarai belt. It is called the malarial belt. When will it become an epidemic? When will it become an epidemic? When its number quickly increases. So an epidemic is often localized in a region, but the number of those infected is significantly higher than normal. Do we get that? So बरसात सीजन में जब तराई बेल्ट में, पीलीभीत में जब बहुत सारे ब्रेन फीवर के केसेस आने लगे, and we were looking at vaccine also, and then suddenly the case came that the healthcare is not in position, then the alarm came. Is everyone okay? Do we understand the difference between epidemic and endemic? So just naming a disease and calling it an epidemic is a wrong thing. It will be declared epidemic based on certain criteria. Everyone okay? Outbreak and endemic, what are these? See, endemic is at one place only. Outbreak can happen anywhere. In fact, endemic can lead to outbreak. Dengue fever is endemic to Africa, Central and South America. Get that? Mosquitoes in these areas carry dengue fever and transmit from person to person. In 2019, there was an outbreak of dengue fever in Hawaii, where the disease is not endemic. Do we get that? So outbreak can happen in areas where it is not even endemic. Say for example, monkeypox outbreak in Kerala. Nipah virus outbreak in Kerala. Heard of this? Heard of the Nipah virus? Do we understand? Were they endemic? No, they were not endemic. But they came. So that is called an outbreak. Is everyone okay? Outbreak possible? Okay. Up, do we have to say, for example, Aman said fruit bat. Yes. Bird flu from the birds also. So do we have to remember which bird, which microorganism, which bacteria? Yes. Cholera किससे होता है? Vibrio cholera. Do we have to remember that? Which virus? Coronavirus. So coronavirus is a set of viruses. Do we have to remember them? So that's for biology. Can we leave them? But yes, if we know some of them, that's okay. तो एक केस स्टडी अगर मुझे लेनी हो, तो अगर मैं बोल रहा हूँ ये डेंगी और चिकनगुनिया, ये कौन करता है? डेंगी, जीका, चिकनगुनिया, ये किससे हो रहा है? क्विकली, चलिए सब मस्कीटो से हो रहा है. ये सुनो, so थोड़ा बहुत, a little bit, if you can keep that in mind, that will work for us. Everyone okay? Are we clear? ठीक है. एक केस स्टडी है मेरे पास zoonosis की, so that you're not stuck with this. Instead, in your answer, you don't have to mug it up. Can you use the word zoonosis? What is zoonosis? Zoonosis is any disease or infection naturally transmissible from animals to humans. So there's a jump happening from a non-human animal to human. Can I say there are genetic barriers? There are genetic barriers, but in certain cases, it is quite possible that some pathogens can cross this species barrier. So zoonosis happens when the species barrier is crossed. Okay? In that, certain bacteria or viral or even parasites may be involved, and some unconventional agents can also be there. आपने tapeworm सुना है? Tapeworm, yes or no? that can be there. Parasite में have you heard of dog से कौन सा होता है? Rabies हो सकता है. So these are all zoonotic diseases. Now, are zoonotic diseases killers? Are they guaranteed killers? Rabies is 100% preventable. Vaccine and other. So we have been living with this. It is not a new thing. We have been living with this. But yes, the direct or indirect contact of water, food, or any other environment can lead to this. Yes. They represent major public health problem around the world due to close relationship between animal and agriculture. अब ये close relationship है animal and agriculture. Tell me, people who are into agriculture, they are into animal husbandry also or not? Yes. Companions and in natural environment. So humans and other species are living. This crossover is possible. This crossover is possible. Possible or not? Why? Because we interact with the animals. We interact with the animals. So ये जो COVID वाला है, COVID कहाँ से आया? It crossed over to the animals. And who's to be blamed? Who's to be blamed? Donald Trump used to call it the Chinese virus. तो Chinese क्या कर रहे हैं? What are Chinese doing? So my दिमाग में आता है Chinese तो यार किसी भी animal को खा रहे हैं. True or not? It is very easy. It is very easy to target some. कर सकते हैं कि नहीं? Sir, eating them. अभी census says they are eating them. जो भी कर रहे हैं. और monkeypox. Monkeypox में क्या कर रहे हैं? There are 200 known types of zoonosis. ये अफ्रीका तो है. क्या कर क्या रहे हैं? Encroachment, interaction. So हम लोग भी तो ऐसे monkey को चना डालते हैं. Can I say that these interactions will be there? These interactions will be there. We need to be careful and we need to be on alert. Can I say zoonosis in itself is a hazard? Zoonosis is a hazard. Can I say people interacting with animals are vulnerable? Can I say that? People are vulnerable. Can I say developed countries which will follow many phytosanitary and all those things? Say for example, they are into dairying industry where humans will not touch the animal. Machines will do that. Can I say their vulnerability is low? Can I say their vulnerability is low? True or not? Think about developing countries. Developing countries where you and the goat sits and sleeps in the same place. तुम और गोट दोनों ही साथ में सो रहे हो. True. So many things. So many things. I'm saying the interaction, the saliva of the animal, the touch of the animal, many things can lead to that thing possible. Allergies, many things are possible. Many things are possible. So it is very easy. It is very easy to say China वाला. आपको पता है? China से पहले I have an interesting thing for you. Yes. This racialized phrasing called Chinese virus से पहले cholera in 1800 the Europeans used to call it Asiatic cholera. Even Indian cholera. They used to blame us for spreading cholera. कि ये इंडिया से आया. Have you also heard of something called as New Delhi superbug? New Delhi superbug. On the superbug, the antibiotics don't work. On the superbug, the antibiotics don't work. So it's easy to call it Chinese virus, but I'm saying, like there are things, where we start blaming that this has come from that country. So right in the beginning, I want to tell you that the zoonosis that we hear of is possible because of our interaction. But what is wrong, everyone? What is wrong? If you remember, there is something called as what is that called as? Cartagena Protocol, biodiversity. Have you heard of Cartagena Protocol? Also called the Biosafety Protocol. People who have attended some environment classes with me, where we deliberately do something with genetically modified organisms. Where we do genetically modified organisms के साथ हम छेड़खानी करते हैं. When we do all those modifications, are we increasing the chance and the problem? Are we increasing the chance and the problem associated with zoonosis? I think I've been talking about hazard turning into disasters. That's there. That is why globally there is a law. Biosafety protocol of UNCPD says that you are not allowed to play with genetically modified organisms illegally, unethically. You need permissions on that. And tell me again, vulnerability. Please understand. Will developed countries respect Cartagena Protocol? They will. Yes or no? Will North Korea respect it? Will non-state actors respect it? Terror groups, will they respect it? Have you heard of weapons of mass destruction and biological weapons? Do you get that? So somebody said, like China is eating bats. No. It is not just eating bats. It is playing with those species and using those species for multiple things. You are coming in contact with things, and that hazard can become a disaster. Is everyone with me? Are we clear? True. So we've understood zoonosis also. Can I expect your answer to have words like zoonosis in this? Again, saying not go into the biology of it. Not go into the biology of it. Also understand that it is not about blaming. It is about we dealing with it. So monkeypox outbreak recently, May, cases of monkeypox were reported from countries where they are not endemic. So can I say a breakout was reported in May 2022? True. And continue to report it in several endemic countries. So endemic may be aaya, non-endemic may be aaya. Okay? Particularly, it is endemic to Western and Central Africa. But it was reported in Europe and North America. Do we get that? It was reported in India also, no doubt about that. Clear? But the fact is that when we saw that both non-endemic as well as endemic countries started showing a rise, immediately WHO declared this is a global health emergency in July 2022. Get that? 2 months ago, they declared it, and before this, they had declared the COVID outbreak to be a global health emergency. Is everyone okay? अभी किसी ने मुझसे पूछा सर इज दिस एपिडेमिक सर स्किन वाला जो पूछा आपने तो एपिडेमिक के लिए यू हैव टू आइडेंटिफाई व्हाट इज द एपिसेंटर कहां पर हो रहा है यूरोप इज द एपिसेंटर ऑफ आउटब्रेक and apart from many things right now many of men who have sex with men homosexual contact led to its spread so it would have come to humans first of all zoonosis happens zoonosis is what zoonosis is you cross the species barrier but after that within the species how is it being transmitted it can be transmitted through saliva through body contact through use of water food and all those things it has been found that in case of monkeypox homosexual contact has also been a very significant cause of its spread. Do we get that? A super spreader event, if you remember, if you were following the news of a party in Europe was in news, so we don't have to talk about that. But since a point came in, that is why I'm talking about that. Why am I talking about this homosexual part is that even sexual activity can lead to the spread of a disease. The most popular one was AIDS. Yes. Can AIDS happen because of non-sexual things also? It can happen. But the fact is, these things immediately stigmatize the whole process. And then people start blaming the victim. Do we get that? Have you heard of because of syringe drug addicts used syringes? They have been one of the biggest spreader of AIDS, especially in Northeast also. So we must be as when we are talking about disaster management, we must be open to the fact that we are not just looking at the biology of it, sociology of it, economics of it. So many things would lead to that. Is everyone okay? So I've tried to keep whatever is the latest July 2022 that is there. Now I want to tell you that a hazard will lead to disaster. So I want to tell you that epidemics and other things, they are public health hazards. How are they public health hazards? Yes. First of all, we are interested in a health system which should look at total health of the country, not only eradication. Do we agree? Everyone. Have we seen bird flu, swine flu, Nipah, and even monkeypox coming to Kerala? True or not? So why does Kerala become an epicenter? And should the planners be focusing on eradication of Nipah or look into the total health system of Kerala and see why Kerala all those things are there? True or not? And a very foolish idea, a foolish answer would be, remember some people said Kerala was flooded because these people eat beef. True or not? Again saying it would be a wrong attribution. It would be a very, very wrong attribution. Can we say when it comes to almost very close to equatorial climate, is Kerala that situation or not? Hot and humid. That's one thing. That's the area in that. Proneness with sea level rise happening and more humidity, so more vectors. That's something. So climatically, that is suitable. Second thing is a lot of place, where we have backwaters, canals. Yes or no? So can I say that there is a lot of opportunity of that water over there? So a lot of exchanges possible over there. Okay. So that is about inherent. Those are the endemic factors over there. Those are the endemic factors in Kerala. Second, let us bring the non-endemic factors. So Ambuj is saying migratory birds. Oh yes, it is a very important migratory destination. But Ambuj, why should we restrict it to migration of birds? Don't we see Kerala population is highly mobile? The population of Kerala is highly mobile. People from Kerala have moved not only in India but outside India also, particularly West Asia and even Africa. Ancient trade routes. True or not? So that interaction also, does it make it a hazard or not? Does it make it a hazard? Now, if you're looking at total health system, should it be based on quarantine then? Quarantine requirements, more health checks and all those things. And surprisingly, you will find that Kerala is more educated in those indices, more, sex ratio also in healthcare and education also it is higher. Still those things are happening. So I'm very sure it will be very, very ridiculous to think that some diet, they eat something and that is happening. That's a very wrong understanding if some people have that. Do we get that? Consequence of disasters on natural human health, please understand, they are not just about health. So I remember we had this thing after COVID, there was something called as black fungus. True. So everyone, during COVID, did the price of remdesivir shoot up? Was there hoarding and black marketing of medicine, of oxygen cylinders, of even hospital beds? True or not? People wanted to save their life. Whatever savings they had, they spent or not. I know of a case with black fungus. They had to, whatever, they had to sell off their property to give it to the doctors. Utna paisa un logon ne lagaya. And remember, a developing country in India doesn't have that health insurance cover. So was it only a human health issue? Did it impact the lives of the people? The livelihood, sustainability? Many people, because of those prolonged COVID things, have they suffered from various disabilities also? True. And can I say, In certain cases, social support mechanism also doesn't work. A case in point is AIDS. Yes, when people look down upon that, when people come to very wrong and erroneous conclusions that you eat beef, that is why it is happening. Can I say that also? True or not? So somewhere the social support, macroeconomic support, another thing, everything goes in a health emergency. Aside from physical injury, infectious disease, please understand, these disasters can leave short and long-term mental health consequences. Have you heard of that or not? Have you heard of that? There is something called as comorbidity also. Physical injury, comorbidity. So an elderly member in my family suffered from diabetes. Yes, prolonged diabetes. COVID happened. He survived COVID, but lost his vision. Yes, so diabetic people, as it is, they are prone to cataracts and all that. They have to look at that. But can I say the vision was reduced, tremendously reduced? I would say 90% loss. Now tell me, a person who loses his vision, will there be mental health issues? Yes, sir. Do we have social support system for them? बहुत से लोगों को कोई पूछने भी नहीं जाता है. True or not? Significant change can occur rapidly in people's lives when they are exposed to extreme events and disasters. This can cause stress to the people, to the families, to the communities. True or not? And eventually mental health disorders. So please understand, the hazards are not just a vector. Hazard is not just malaria. I want to tell you, it is invariably this time when we have mains. Mains ke time chikungunya and dengue. Chikungunya and dengue is the mains one. So many students, when they report to me in the last 5-7 years, around mains, it has been very, very common. Mains happens after monsoon. So in Delhi, many boys and girls contract chikungunya or dengue, and that really compromises their attempt. True. And I also want to tell you, at times, public health and disaster can lead to break in the supply chain. Yes, so risk dying when there is non-availability of lack of access to healthcare. Please understand, lack of public health is also a disaster. True or not? Compare the healthcare which is available in southern states with EAG states. Do we understand the impactability of the epidemic? Do we understand that? People with chronic diseases have ongoing medical needs, and sometimes health services are disrupted. Disaster situation. मैं तो कहूँगा, everyone, I don't know whether you will take it or not. श्रीलंका में medical disaster है. Because of all that inflation, people first could not afford the medicine, and second is the medicines were not available. Essential supply shortage. True or not? So that is going to be there. Is everyone okay? Now you must be wondering, what are we talking about? Well, we are talking about, as I always say, that our questions, UPSC question will not be about, UPSC question is not about, do we see list down epidemics in India? Yeah, no. This is not going to come. You will be asked, explain the causes. Possible? Consequences. Management of epidemics. True. Will you need points or not? Will you need ideas or not? What is epidemic? What is an outbreak? What is endemic? And how health system has to gear up for that? And do we have case study in India how health system was not geared up for that? COVID. Yes. And can we connect it to that vulnerabilities and risk increasing because of that? Can we also bring in the idea of spatial component in this by saying that there is a north-south divide, rich-poor divide in terms of healthcare in India? True or not? Everyone with me? Any questions, please ask. Clear? Let's move further. Public health. How a case study of that. Western Africa, Ebola. If you've heard of Nigeria. Devastated health facilities and people's trust in healthcare providers. Yes or no? People's trust, if it is broken in healthcare providers, it's a very, very big challenge. Thankfully, Indian health workers faced the COVID challenge. Do we agree or not? The health workers, the nurses, the doctors, the frontline people, many of them gave their lives. They did not, they were, except उन पे फूल बरसाने के लिए मोदी जी ने thank you तो किया था, but बहुत से लोगों को wages, salary कुछ भी नहीं. True or not? They kept on working. I'm saying, if in a epidemic, if people lose trust in their healthcare providers, imagine the kind of distress that will happen. Can I say, when there was a second wave, the oxygen shortage, people lost trust on healthcare providers, especially the hospitals, fleecing money. True or not? That made a panic come in. As long as the government was saying that we are with you in the first wave, the health workers also, they were resilient, they worked on that, but suddenly, there's a shortage of this, black marketing and all that. Was it the health workers or was it the opportunistic people who were making maximum out of that emergency. Do we get that? The fragility of the health system and lack of resources to manage the isolation and treatment patient overwhelm the existing capacity of healthcare providers, local and national government. This happened across the world in COVID also. ये Ebola का है, a case study on Ebola also. Get that? The health disaster resulted in severe budget cuts on non-Ebola related health services. Did you get that? That only we were looking at COVID cases. People who had other medical emergencies, did they face a very big challenge or not? Did they face a very big challenge or not? I seriously want to tell you, these are very, very big things. So I know of a selected student. She in her last attempt this year she's selected, but in that attempt she had COVID, and with that extended COVID, and the platelets would not even not platelets, kya hai wo? Antibody count also did not increase. Again got COVID, and then mother also diagnosed with a tumor in the brain. All the time throughout the examination preparation, she was dealing with that. If you think your life is difficult, think about that student's life. Get that? She cleared in that attempt also. She cleared in this attempt also. She cleared in that attempt also, cleared in this attempt also. And when I used to talk to her, she said it's a very big problem to talk about my mother's health, to take her to the hospital, but there are only COVID cases that they're dealing with. And she said, I'm the only one to take care of my mother also, because a woman is allowed to stay with another woman over there. Yes or no? Usne bola, my father is very old, sir, he cannot, so I will be there. Attendant ki tarah bhi. COVID bhi proneness बढ़ जाती. Everything is there. Everything is there. True. Significant reduction in use of health services owing to fear of cross infection. Have we all seen this or not? Now tell me, this girl, did she give me the reasons for failure, or this girl was unreasonable? जो भी है maximum कर रही. See, when we are writing this examination, no, most of us are pessimistic. पता नहीं होगा या नहीं होगा. Is my answer writing good or not? Did I do my homework or not? Did I read the book or not? She was, whatever I know, sir, I will do my best. I cannot think anything else. I have to take care of my mother and father. I myself contracted COVID 2 times, so I have to take care of myself also. True. If my mother is to be hospitalized, I have to be there also. अब इसमें जो पढ़ पा रहे हैं पढ़ भी रहे. And the girl clears everything. Think about it. As a result, more people are estimated to have died from childbirth, malaria, and AIDS, as well as other diseases. This is called comorbidity. बाकी disease से लोग मर जाते हैं because they lose faith. This girl never lost faith. She did not make a choice. She said, I have to do this exam also, and I have to take care of my family also. Get that? So that's the character that is needed for dealing with hazards. Can I say this girl had done a lot of risk reduction? Her vulnerabilities were low. True or not? She said, I am the one, I will be working, whatever is possible. I was in close touch with her throughout her preparation, evaluation, late submissions. Everything is there. Everything is there. When a student is deserving and when the student is not stepping back, why should the teacher give up? So I'm also inspired. I'm supporting her fully. And then she produces results also. True or not? इधर क्या है? क्लास में एक आंसर सबमिट नहीं करेगा. Sir, can I submit answer to you? क्यों भाई क्लास में तो करो. Why? So that's what I'm saying. These people, good, bad, ugly, they will work on it. They are willing to take feedback. They don't have a super ego like, this thing to boost anyone कि मैं ये हूँ वो. भाई इतना है, धीरे-धीरे we are growing. In fact, what happened was mains started. Okay, mains started, and I was talking to this girl 3 days before mains, and she said that I have COVID and my mother's case is also very difficult. On the day of the mains, I called her up. She did not take my call. During the mains also, I sent her messages. Nothing. And then after the mains was over. After 15 days after mains, she replied to my message. So I said, let's talk. Why message? So let's talk. So I called her up. First question was, did you write mains? She said, yes, I wrote mains. She said, वो तो करना था. But it was such an emergency, sir. I had nothing. I don't even know what was happening in the world outside. I would go write my exam, and that's all that is there. COVID तो तब तक ठीक हो गया था, sir. COVID, I was, like, this was better. This was the only thing. By that time, my COVID was over. But my mother was still in the hospital. Exam भी देना था. माँ को भी ख्याल रखना है. Everything she was doing. She said, I did not have social media बंद. I know you would have called, sir, but मैंने सब बंद कर दिया. So that's important. I'm saying you will face such emergencies. Be prepared for that, for this examination. Get that? चल, India में देखें temporal. India में let us look at temporal epidemics in India. So cholera was primarily a disease of countryside. India में जो cholera की बात आती है, cholera, from that generally water with bacterial activity, standing water that can create those things. It strikes the villages and wiped out communities. Whole community dies because of cholera. Get that? Cholera symbolized rural vulnerability in the face of illiteracy. Can I say, have I connected that epidemic hazard into vulnerability? Have I brought that idea of vulnerability? So please look at that. How would you bring in those ideas which will make your answer popular? Do we get that? Rural vulnerability, why? Because illiteracy is there, poverty is there, disaster ke liye, all that filth, garbage is there, and underdevelopment. Epidemiological studies in the colonial period reveal, so I've gone a little bit into the history also, 1896 to 1921, over 30 million people fell prey to epidemic diseases like bubonic plague, cholera, malaria, smallpox, influenza. Of these, 10 million belong to Punjab, Northwest Frontier Province, and Bombay. Between 1896 to 1921, as many as 12 major cholera outbreaks were recorded in British India province, killing 0.25 million people. This figure is exclusive of the fatalities induced by malaria, smallpox, and all that. So, if you remember, I told you epidemics, famines. Yes, famines also. Have you heard of famines? And I told you famine is something where imminent deaths will happen. Why did I talk about 1921? Why am I talking about 1921? Everyone, do you remember? After 1921, India entered something very specific. What was that? Demographic transition window. We entered the transition stage. How do we enter the transition stage? Our healthcare improves. Do we get that? So till then, you can see that these diseases were acquiring the dimensions of epidemics because healthcare was not there and vulnerabilities were very, very high. So again, can you bring in demographic transition theory, those ideas when you're writing the answer? If somebody asks you epidemics in India, you don't have to write all this detail. Can you say till 1921, after which India entered the demographic transition on the back of improved healthcare, it was seen that in that time, pre-21, epidemics was a very, very normal thing in India. The rural areas were particularly vulnerable, and as a result, epidemics like bubonic plague, cholera, malaria, smallpox, influenza were big killers. Can we do that? एक लाइन में एक सेंटेंस हमें समझ में आ गया. एक पॉपुलर प्लेग हुआ 1896 में, प्लेग हुआ बॉम्बे में. 12 million people across the country were wiped out. Yes, acute social disorganization happened. A catastrophe of such magnitude forced the colonial government to propose a drastic act. तब वहां पर even British time में आया था Epidemic Disease Act in 1897. Imagine that was an outcome, and even till now we see some of these things heard in our epidemiology debates. Is everyone with me on this? So all this is not to be written in the examination. Can you bring in the idea of DTT and say before that epidemics were very, very common? Yes, hazards were high. A disease would acquire the proportions of epidemics, and invariably that would lead to famines also. famine भी होगा, लोग भुखमरी भी होगी, मरेंगे भी. All those things are there. Some temporal epidemics, cholera post-independence. So post-independence, अगर post-independence लिखना हो, cholera pandemic, 1961-75, started from, imagine, Indonesia. A strain it replaced a new strain of bacteria, not the classic Vibrio cholerae. Yes, so India got that. Polio epidemic, did we hear of this? India was the worst affected, and we started the expanded polio immunization program. Do boon zindagi ki we have been able to get rid of this. True or not? Similarly, smallpox, heard of this? Worst smallpox epidemics of 20th century. India contributed about 85% of the epidemic worldwide. Smallpox was India's killer. Imagine, this epidemic broke out in 3 different villages in West Bengal, Bihar, Odisha, but it was impossible to establish a connection between men. Hence, it was treated as 3 different epidemics. So, वहां से शुरू हुआ 1974. Get that? Surat plague epidemic. Surat plague epidemic 1994. Remember of Surat? Surat में suddenly plague आया, and after that, Surat municipal corporation totally transformed. It was such a shameful thing. Plague happens because of rats, and it was a big fear. I don't know whether you were at that time born or not, but for us, when we heard that, it was like as you are hearing of monkeypox, we heard about plague. Our interest, I was a kid at that time, so my interest in rats, grew. अभी तक rabies ही पता था. True or not? 2003 dengue, and it was a very big one in Delhi region. It reached its peak around October, November. I told you October, November is post-monsoon. The mortality rate around 3%. It became a major outbreak of India despite its widespread preventive measures. Is everyone okay? 2003 SARS. By this time you were born. Most of you were born. Yes or no? Severe acute respiratory syndrome is considered the first serious infection disease outbreak of 21st century. So dengue to tha, but SARS became a very big one. Again coming from China, Guangdong province of China, and spread to 30 countries in Asia, America, Europe. SARS was also caused by coronavirus. This is a category of virus believed to be an animal virus, and again found in bats and civet cats. Is everyone okay? Heard of these names? So these are some things which is in history. Other than that, quickly tell me, now you are born, तो कौन-कौन से आपने सुने? So after Delhi, 2006 May, dengue and chikungunya happened once again. Quickly tell me which you remember in recent times. 2009, I also heard of this hepatitis B. Many people started talking about hepatitis B. Yes, and this started in Gujarat. The outbreak happened in Gujarat. Gujarat was the epicenter. और ये कहाँ पर था? ये दिल्ली में तो है, NCR plus many other locations in the country. Do we get that? 2014-15 saw swine flu. Swine flu. When we are talking about swine flu, Gujarat, Rajasthan, Maharashtra, Telangana. H1V1, Gujarat, Maharashtra, Telangana, even Delhi. Delhi region, one of the worst hit in this. Do we get that? 2017. Remember encephalitis? Japanese encephalitis. Particularly UP Terai Belt. UP Terai Belt, if you remember, Gorakhpur case. Do we get that? 2018 Nipah virus in Kerala, fruit bat से. Some people are writing Ebola, but Ebola India में ऐसा नहीं था. अभी we are talking about India. So dengue, chikungunya, I understand. Ebola आपने इंडिया में कहाँ सुना है? बताओ मुझे. 2019 we are looking at coronavirus. Pan India, can I say that? Pan India. 2022 monkeypox. Monkeypox Kerala. Can I say that? Yes, sir. SARS chapter. So that's okay. I'm just looking at this thing should come to us that you have some names. Everyone, epidemics के बारे में कुछ समझ आया या नहीं आया? Did we understand something about epidemics or not? So manage कैसे करें? How do we manage it? How do we manage it? How do we manage? How do we manage it? Measures, okay. What else? सब ये जनरली चल रहा है यार, कुछ और something deeper. Healthcare, public awareness, precautions, okay. Vaccination, perfect. Again, फिर आप वो नहीं सोच रहे हो. Vulnerability and risk. इनको मैनेज करना है ना. Manage them as pre-disaster. Pre-disaster, manage them, and then post-disaster also. Get it? In fact, I was reading this. This is 9th September. 9th September, Hindu newspaper. 4 days ago. 4 days ago, there is something very, very interesting. This was the editorial page, and it says the outline of an essential global pandemic treaty. The treaty under the umbrella of World Health Organization would build coherence and avoid fragmentation. Very beautifully written about how World Health Care was not being taken care of, how developed countries have more vulnerability and this thing. So can I say India has special vulnerability? Do we have that? India has special vulnerabilities. Think about it. जो general चीज़ है ना, health care करेंगे, hygiene करेंगे, those are going to be there. Think specially on this. No, what are the vulnerabilities? Coastal areas, different vulnerabilities. Terai belt, different vulnerabilities. Urban areas, different vulnerabilities. Rural areas, different vulnerabilities. Developed states, different vulnerabilities. EAG states, different. Tribals, different vulnerabilities. True or not? What are the risks associated? What is the possibility of this thing happening? Possibility and probability. True. Possibility and probability. So can I say the possibility and probability of zoonotic disease and pandemics entering India is higher on coastal cities? Coastal cities versus Delhi. And Delhi we have because Delhi we are not just looking at port, airport also, whereas working compared to the tier 2 cities. True or not? Coastal cities plus big airport cities. Do we have to understand that? Okay, so that has to come. That has to come in your general thing. General things, so we will write down. General thing, whatever we learn from disaster management, yes, we should have vaccination, we should have the healthcare people ready for it, we should have people awareness. We are talking about that today. I talked of many things in my disaster class today when I took that GS class. So I talked of many things there also. True, but the fact is that would you be able to bring in specific things? क्यों कह रहा हूँ? Because हमारा question क्या आएगा? Please write a question. How does it differ from pandemic? First part of the question. Second part is present. Now think about it, everyone. Whatever we have discussed, can we put that? Can we put whatever we have talked about? The areas that I have given to you, will they serve you good? What all pandemics have happened, epidemics have happened, are they needed or not? True. Clear? Next question. Critically analyze the efforts in handling epidemics and diseases. Epidemics and diseases like Nipah, monkeypox, COVID-19 in India. Tell me easy questions or challenging questions. पढ़ना एक चीज है, सब समझ में आ गया. Critically analyze the efforts, vulnerabilities, risks. Answer writing is going to be a challenge for that reason. And again, if it was just a beginner class, I would not have given you these questions. I'm giving you these questions so that you can think and link spatio-temporal analysis. Spatial also and temporal also. Imagine. Spatial and temporal. Temporal कैसे करोगे? Everyone. 1649 to 16 कितना करें? 57. Break में switch करो. Break में think about these answers. 10 minutes रखते. 10 minutes का break है. Everyone think about what would you put in temporal. Temporal कैसे दिखाओगे? Spatial कैसे दिखाओगे? We'll have that. Get it? So 10 minutes break. See you after the break. So spatio and temporal. How are we going to deal with them? ये तो ठीक है, everyone. What is epidemic? How is it different from pandemic? That's easy. Spatio-temporal, how are you going to do? Dengue in Terai. Rather, Neeraj, everyone. Can I challenge you, everyone? Can I challenge you? Based on the class or whatever you know, let us make an epidemic map of India. Try करें. AP, let's challenge each other. ये है नहीं ना कहीं पर, ये तो हमें बनाना है. We have to do it. बनाते हैं. चलो, let us start. मैं भी बनाता हूँ, आप भी बनाओ. Let us challenge and draw this. ये है नहीं ना book में. But I want to get marks also, and I want to be confident also because my question is spatio-temporal. You keep thinking, I am also thinking and making it. Everyone, can we make something like this? Epidemics make sense? Especially they have been there, Nipah or monkeypox. Spatial. Keep adding. Can we take info from internet? Have we started our epidemic map? So if a question comes on spatial analysis, can we do that? Temporal. How are we going to do temporal, everyone? How are we going to do temporal? Everyone, how are we going to do temporal? Quickly. Data, okay. Data. Or kuch table. You keep on doing data and table, and there will be competition and people will keep moving ahead of you. कौन सा ग्राफ बनाएगा कुछ पता नहीं है. ठीक है सर, ये तो देखा है, क्या है, व्हाट इज दिस? एपिडेमोलॉजिक ट्रांजिशन. Epidemiologic transition. What is epidemiologic transition? A process by which the pattern of mortality and disease is transformed from one of high mortality amongst children, famines, to one of degenerative and man-made diseases, lifestyle-based diseases, particularly affecting elders. So what is this? Let me tell you. Stage 1. Infectious diseases. Get it? Natural checks on human population. Is everyone okay? Are we clear? This is a mother. This is the first stage. This is the first stage. This is the second stage. We call these two stages as the infectious disease stage. Can I say 1921? India was dying because of many diseases. कौन से disease हैं जल्दी बताओ, क्या हो रहा था यहाँ पे? कॉलरा हो रहा था. कॉलरा was killing. और क्या मार रहा था जल्दी बताओ? कॉलरा, मलेरिया, प्लेग, yes, pox, ये सब मार रहा है. Influenza. 1921. Everyone, am I talking temporal for India or not? Now second stage, what happens? Sanitation improves. Remember British law? British ने भी epidemic law लेकर आया था कि नहीं? Yes, the freedom struggle, national movement, and they were all talking about it. कुछ करना चाहिए. Yes, medicines made available, nutrition made available. So what happens? This stage is called receding pandemics. Is everyone okay? 1951. Everyone clear? So government was checking on pox. कुछ करेगा? करने की कोशिश करेंगे कि नहीं करेंगे? Yes, we have more sanitation coming in, more lifestyle changes and everything. That's the second stage. Third stage में जो disease है, third or fourth stage के disease, these are called chronic diseases. या 91 ले लो, 1991 तक liberalization तक. These are degenerative and man-made diseases. Degenerative. यहाँ पर क्या आता है? जल्दी से बताओ. ओबेसिटी. आजाद होने के बाद ओबेसिटी बढ़ा है इंडिया में, ऐसा ना? डायबिटीज, हार्ट डिजीज और क्या है? बीपी, शुगर वो बढ़ रहा है. कैंसर, ठीक है. HIV और STDs, India has also witnessed this. India has also witnessed this. प्रियंका में तो कम होता जा रहा है ना बच्चे, मैन-मेड डिजीज नहीं है ना. Fourth one is resurgence of, this is what is happening post 1991, resurgence of infectious diseases due to globalization. जल्दी बताओ इसमें पैंडेमिक्स आ गए कि नहीं? SARS, swine flu, bird flu or avian flu, COVID, monkeypox, Zika, Nipah. Everyone with me on this? This is also about some delayed degenerative diseases. Have you heard, or from say Alzheimer's, Parkinson? Have you heard of that? Is this geography? No, this is not geography. ठीक है, epidemiology है ना यार, epidemiology. But if you ask me temporal, can I use these ideas smartly? The process by which the patterns of mortality of a disease transform from one amongst children, famines हो रहा है बच्चे मरते हैं ये वो, to the one amongst degenerative man-made diseases, particularly elders में. Remember Alzheimer's, Parkinson? Have you heard of these diseases or not? अब बताओ spatial temporal के लिए कुछ ideas. Spatial temporal, have I in my discussion have I mentioned something of this? You don't have to give all these details. Can you say that India has made a transition in its epidemiological transition from infectious to the chronic lifestyle based diseases? Yes, and some of them rising to the levels of epidemics, because not everything is epidemic. Remember, not everything is epidemic. Okay? Some of them rising to the level of epidemic. So these hazards are there. If we don't manage, so that will go on that. Can we do this? Possible? So अब इस क्वेश्चन के लिए कुछ सॉलिड है हमारे पास? Do we have something solid? Spatial also, temporal from internet. Somebody said data. No, यहाँ पे dates डाल दो यार. Put some dates also. 2019 monkeypox, 2022. Can you put that Japanese encephalitis 1920? डालो. Can we do that? I'm saying the topic is clear. We've talked a lot about it, but will we be able to write an answer? That's a challenge. Critically analyze efforts in handling Nipah, monkeypox, COVID-19, and many more, etc. So efforts in handling. जल्दी बताइए. What are the efforts? Quickly tell me what are the efforts in handling. इसी मैप के साथ में लिख रहा हूँ. What are the efforts in handling? Integrated disease surveillance program. Yes. Universal immunization. Special programs जैसे पल्स पोलियो. और क्या है? डॉट किसके लिए? Everyone, if you remember, डॉट के लिए क्या है? डॉट किसका प्रोग्राम है? टीबी. वेरी गुड, टीबी के लिए. Even livestock vaccination. Aman is saying Indradhanush. So Mission Indradhanush is about vaccines. Yes or no? So you can talk about that also. Mission Indradhanush, whatever you are talking about is absolutely okay. ठीक है? मुझे लगता है ये तो पॉइंट्स है ना, जैसे किसी ने कहा मिशन इंद्रधनुष. Can I say use of information technology for information dissemination? Did we see information dissemination in COVID? कितने केसेस आ रहे हैं, क्या आ रहे हैं? Yes. Diffusion of info, safety measures. True or not? Preventive measures, early detection, screening. हाँ बिल्कुल ठीक. Retract, test, treat. Yes, perfectly okay. Then identifying pockets. Yes, improved healthcare. All these things are there. डाल सकते हैं. मोबाइल डॉक्टर कैंप, वही मैं कह रहा हूँ, बहुत सारे मोबाइल ऑनलाइन सपोर्ट. ट्रू. आरोग्य सेतु ने क्या किया पता नहीं. आरोग्य सेतु क्या आरोग्य सेतु ICT किसका है? आरोग्य सेतु. Government doesn't know आरोग्य सेतु किसका है, but आरोग्य सेतु is there. True. Wow, these are amazing things. कुछ तो दिखाई दे रहा है, नहीं दे रहा है? Are we able to see something or not, everyone? कुछ इंश्योरेंस भी डाल दें. अब इसको you want to make it pre and post disaster, you can add it, make it into pre and post disaster. Can I say you can make it a homework? Pre and post disaster. Sneha was talking about mitigating vulnerability. Sneha, you can make it mitigation where mitigation is happening. Yes, where preparedness is happening, where relief recovery is happening. All those things are there. Pre and post. Can you do that, everyone? I just wanted to give you some things. But now my question is not this. My question is not this. My question is this. There is a question mark on this itself. There is a question mark on this itself. Everyone, you might be happy. Wow, brainstorming ho gaya. I know what are the things. Sir ne bata diya. Critically analyze their efforts. So that's a big challenge. When you're looking at critically analyzing, means are they sufficient or not? Adequate in terms of quantity, quality, adequate spatially, spatio-temporally. True or not? Second wave of COVID. Do you think critical analysis handling was good? Government says nobody died of oxygen shortage. Yes or no? So आएगा कि नहीं आएगा? Will it come or not? पहला तो मुझे ये लगता है. First very clear thing is everyone look at this. Everyone look at this. Bed capacity आएगी. Spending on healthcare. Spending on healthcare. Get that? Around 10% of GDP in Germany. Get that? China 3+. India 1 to 1.5%. True. Is it adequate? Quantity. Do you get that? Doctor-patient ratio. कोई डेटा मुझे मिलता नहीं है कि मतलब जो रिलाई करें वो जो भी डेटा आता है वो बदल जाता है. True or not? The data will change. Lack of primary healthcare infrastructure. Everyone, can I critically analyze this? Can you take it as homework? In points per, I will look at the latest data. How much is the spending on healthcare? What is the current doctor-patient ratio? Submit to me, कोई दिक्कत नहीं, बनाओ जैसे बना रहे हो, जो भी बना रहे हो करो. Preferably spatial. You can also look at the, इसमें भी spatial variation है. There is spatial variation. True or not? Quality. Healthcare staff. Skilling. Training. And even infra in terms of testing. Questionable. Questionable or not? Do we still have some Jhola Chhap doctors? Have we ignored Ayush? Have we ignored holistic healing? Ayush, traditional ones, are they ignored or not? We need that. Only Western support cannot work on that. Yes or no? Lot of quality in this quality. At times, you know, I think the treatment and medicine are incomplete. In fact, patient himself doesn't continue the treatment. Remember, that's the problem with TB. If you do not complete the program of TB, then TB can become resistant. In fact, so much of drug resistance, especially antibiotic overuse. Big challenge or not? What else? Reporting gap. What is reporting gap? So everyone, are the COVID figures in India correct? Are the COVID figures world over correct? And why COVID? Even TB figures are wrong. Oxygen cylinder figures are wrong. Big issues with that reporting or not? That data which is being given, at times, you know, they are just in compliance, just in papers. Yes or no? In reality, they are not there. We are talking about, you know, say healthcare infrastructure. यहाँ पे social security in terms of insurance is also missing. True or not, everyone? Another very important thing temporarily, I would want to say delay in action. Delay in action. COVID second wave, Nipah in Kerala. Example, case studies दे सकते हैं. We are talking about early diagnosis. Early diagnosis is not happening and you're not reporting it. Big challenge happening or not? We are looking at technology, National Virology Institute. National Virology Institute, Pune. Private vaccine manufacturing as a big issue. We need to upgrade this. Do we need to upgrade or not? And should Coronil be sold as a medicine for COVID? Baba ki Coronil भी तो है, बाबा ने लगे यार वो भी निकाल दिया, गिलो है. In fact, I would also want to bring in, remember, I was talking about what is this Sendai framework? Community responsibility. Is that strong in India or poor? Did people stand for each other? Did people stand for each other? Creating that community capability, community interactions. Everyone, whatever I'm saying, can this debate end now? Whatever I brought, is this an intelligent debate which we are having? Have I given you, 3-4 points, diagrams, graphs, and everything? Do you have everything to write an answer on? But still, answer writing will be a challenge or not? And whatever we are talking, are they in the books? And again, can I talk all this to a beginner audience? I cannot. I have to look at my audience. I have to look at my students who can think. अभी भी यहाँ पर अगर कोई beginner को होता ना सर dictate करवा देते. A beginner would say, sir, please dictate. If you ask me to write it again, I can't write it again. I will write it in a different way. These were the thoughts which were coming to me, and I'm doing that. If you ask me to write an answer लिखने से पहले मैं तैयार हो जाता हूँ. Before writing an answer, what do? Remember, I started my class with that. Before I begin to write an answer, I first make a framework. Clear answer sheet कहीं है कि नहीं? I'll do this, and then I'll fit in everything. Make sense? Introduction: disasters, health hazards are here to stay. Some endemic, some non-endemic. The challenge lies in not allowing them to acquire the proportions of epidemics and pandemics. In this light, one must spatially, temporally analyze the hazards or epidemics in India. Have I created a context? I've created a context. And then, did I give you everything? Spatially, do I have a map and I can write a lot about it? Temporally, did I tell you about the theory also and how things are changing? Temporally, India is no different. India is also seeing that. Yes or no? Spatially, temporally, if I have to look at critically, however, all this could have been avoided based on certain steps. These are the steps which India has taken. True. Are these steps adequate? Well, they are a good step in this direction. They are a good step in this direction, but a lot needs to be done. And I'll bring my critical analysis. Remember EIA? Did we go into deep of EIA? Is everyone comfortable with EIA? In fact, somebody sent me a message कि सर ये सब EIA यहाँ पर ये सही नहीं हो रहा वो नहीं हो रहा. I don't remember. Somebody sent me, sir, this EIA violation happened recently. True. So people are sensitized about it. EIA, be it GS1, GS2, we'll be able to do. I've been talking about hazards for last 2 days. Are we comfortable with hazards? Floods. Have we taken case studies and everything? Anything on flood, drought, even landslide? Can you handle them? Can we handle these things also? Epidemics. Tomorrow's class, I will be talking about going into some industrial and agrarian unrest. Is everyone okay? I'll be going into some miscellaneous topics. That is what tomorrow's class is. I have not talked about India's disaster management in special class today. So I'll try and keep that special class so that we can have India's disaster management also through those things. There are certain gaps which I'm leaving for you. Say, for example, what would be the pre-disaster, what would be the post-disaster. In that special class, we will bring that also. Is everyone okay? Tsunami, आज नहीं करते. I have some work to do. Tsunami भी तो बचा है. Tsunami कल करते. We'll do tsunami and industrial and agrarian unrest. I think with that, key topics would be covered, and we'll see what all will be left after that. So see you tomorrow. Thank you. Bye-bye. And if people are asking something about the new course is starting on 7th of October.